liked. I would like to now welcome our expertise, Dr. Pridama Sangraju Garu, who is our principal from Lakshmi Yashoda College of Nursing. I welcome you, ma'am.
Thank you, Shanti, for being together in the same platform in a series of webinars.
Yes. And also, I would like to welcome Dr. Simil Babu Garu, who is a Vice Principal Professor from Holy Family College of Nursing, New Delhi. I welcome you, Dr. Simil.
Thank you, Shanti, for being part of it and for this opportunity, for being part of all of you. Yeah.
Thank you. And I would also like to extend a warm welcome to my learners, none other are bedside nurses, who is Mr. V. Shetty, a senior nurse from Siddhamma Multi-Speciality Hospital from Gulbarga. I welcome you, V. Shetty.
Yes, ma'am. Good afternoon, ma'am. Firstly, I thank you, Dr. Abhishek Malik Patil, sir, and Shanti, ma'am, for giving this opportunity. So, thank you.
Thank you. And also, I'd like to welcome my staff nurse, who is Miss Lydia Babu. Lydia, are you audible?
Yes, ma'am. Thank you, ma'am. Thank you for this giving this wonderful opportunity to speaking in front of your all honorable dignitaries, ma'am.
Thank you. We all will learn together. Yes. So the first insight we would like to understand from Dr. Siddhamma Garu, like, has bedside handover an improved strategy in the current hospital scenario? Not only we are talking about Yashoda facility or any other facility, we're just trying to understand in a generalized way. Yes, ma'am. Over to you.
Yes, Shanti, you're right. And because bedside handover is indeed an improved strategy in the current hospital scenarios, but not always. Yes, sometimes there are lapses found in the hospitals. In spite of having a structured, communication tools available, but still people are unable to implement it because there are some lacunas. So the patient handing over, taking over is a very important this thing. There are time constraints, patients discomfort, and also the confidentiality concern. The patients may not agree sometimes, and apart from that, the patients will be, they will be privacy need to be maintained with confidentiality. So overall, the bedside handing over is a valuable strategy for improving the patient safety, to enhance the patient involvement, and promoting the effective communication in the hospitals. These standardized handing overs, taking over scenarios are very important. But the challenges are existing still. Addressing those challenges, like standardized tools can be implemented by training the nurses in the bedside, giving scenarios and handing over scenarios by making them record, and so that is the way we should give opportunity for the students to become confident in handing over scenarios. Because
I appreciate your insight on the same, and let us have hear from Dr. Simil what's happening at your facility. Yes, over to you, Dr. Simil.
Yes, Shanti, that handing over at bedside has been implemented in many hospitals. Yes, it improves the handing over process, but there are lapses also. WHO data, recent data shows that patient safety is a major concern. 1 in 10 patients worldwide is getting harmed in clinical care settings where patient comes for treatment. And countries like developing countries like India, the data is alarming, like 4 in 10 patients are getting harmed. So we need to do more for getting the things for better for the patient safety.
Yes. So going forward, we would also like to understand from Lydia, what are the few critical information, Lydia, as you may be experiencing whenever you go to, take over at your facility? Yes. What are the few critical information you bound to miss during handover? Like, let us have your understanding on the same. Yes. Over to you.
Yes, ma'am. As in is, we will miss some important or a few informations during handover, like medication changes, like maybe doctor will change the dosage of medicines, and if they will sometimes they will miss any allergies or alerts the patient is having, and escalation of some lab results and investigations, and scheduled administered treatments, and some pending tasks are common things are missing during handover, ma'am.
Yes, yes, very valid points. These are really few minor problems which always occur at the bedside. Let us also understand from Veer Shetty. Veer, over to you. What critical information we forget and we
Yes.
fail to inform to the doctors. Yeah.
So nurses want to miss some sudden deterioration of the patient and shift, and some neurological status also will change, like GCS changes.
Yes.
Some example, a patient was a fine day, but sudden increase agitation or like some the oxidation desaturated.
Yes.
So before shift, it gets sent to miss sometimes.
Yes. So, and also we, sometimes we miss, there are a lot of timely care lapses are seen. Like, I am supposed to provide, some, position change to the patient at a particular time. And those
Yeah.
lapses are also, seen. Okay, going forward, we will again understand, like, should you girls or should you nurses be given checklist or for structured organized handover at bedside? Yes. Over to you for your insight, Lydia. Yes.
Yes, ma'am, we have to be like, because it ensures the consistency in handover, especially. And the next point is it covers all necessary informations, ma'am, and related
Yes.
to the patient, and increase patient safety. And most importantly, it reduces the errors while providing care to the patient and treatment, etc., ma'am.
Yeah. I think these checklists are like a reminder, 1, 2, 3, 4. You got to do everything in a
Yes.
ordered
Yes.
manner. Yes, Veer, what do you think that what is your take on the same?
Yes, ma'am. Others should
Appreciate.
provide checklist as it encourages to professionalize accountability. Also, it helps
Yes.
to remember to key points during a busy shift also.
So checklist hona chahiye. Yes.
Yeah, ma'am. It's me.
Yeah, it is important. Yes. Now, we would also understand from Siddhamma Madam, in spite of this checklist, this pathways, this guidelines are there existing in every hospital scenario, right? In spite of having this ISBAR tool, we also see a lot of lapses. What is your perspective on the same, ma'am? Over
Yes,
to you.
Shanti, despite of having a standardized tools like ISBAR, SBAR, still lapses occurs because of various reasons, like human errors can happen because of lack of attention in dealing the handing over scenarios, and nurses get fatigue, and some they get distractions due to some other workloads, and inconsistent implementation of the standardized tools in a communication also one of the reason why there are lapses. Lack of training and practice, and time constraints because rushing handovers of nurses keeps happening. So all these variable reasons are there why unable to practice the standardized tool and systematic handing over system. But
Yes.
complexity of the patients also is a very much very important to know.
Important. Yes.
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 So
Yes.
we should have an handovers sessions, hands-on skills, and we should review the documentations, solicit the feedbacks are necessary,
Yes.
and we have to analyze the near miss events so that
Yes.
we could be able
Yes.
to overcome all those things. And
Yes.
I fully agree that by validating the checklist through the physical observations, by addressing the potential reasons for healthcare through healthcare organizations can be improved, and for an effective implementation of the standardized tools in practicing systematic handing over, taking over sessions.
Yes.
Thank you.
So here we would like to add on, I would like to add on, though we have very beautiful or organized, structured checklist in a format, but how potentially or how very greatly evidence-based validations are taking place. So we request all the nurses here validate these checklists along with your relevant physical observation with your patients. Yeah. going forward now, we would like to understand from all of you, like, yeah, over to you, Similji. For do nurses check patients and patients inventory before or post a handover? Like, yeah, this for the Veer's perspective. Yeah, Veer, over to you.
Patient bedside, when we are getting charges, when we are giving charges, that time the patient, we have to see the patient position also, like the ECG leads were displaced or any pressing or not done. And also in
So we,
inventory, some medications doses will be, high dose will be there.
yes,
And some
yeah,
injections are leviable, it is given or not, like that.
yes.
Sometimes it will be missed. You have to check that time.
Yes, these protocols are already in the place. These are the fundamental care which nurses should always abide by. But I'm just trying to ask whether does really it takes in a real patient bedside scenario. Yes, Lydia, what you have to say? Over to you, Lydia.
Yes, ma'am. Most commonly, we nurses will fail or forget to check the inventory, ma'am, because patient in bed, the new medications is kept at in bedside or not, or intended or not, or any new medications doctor prescribed, whether it is in patient bedside or not, we have to check, and if any sensitive reactive medications are there or not, we have to follow the protocols also, ma'am. So
Yes. So you should say you really agree that yeah, we should also check these
yes, ma'am.
formats as well, right? Yes.
Yes, ma'am.
So going forward from Simil, do nurses review doctor notes to understand instructions and recovery of the patients? I think this learning will start from the reading notes and understanding what one terminology is about or what are the instructions about. Yes, over to you, Simil.
Nurses often, of course, nurses will review doctor's order, but the question is how often they review. I mean, they may be
Yes.
reviewing it and reading it once in a shift, or are they reviewing it before every procedure and every intervention?
Yes.
It's very
Yes.
important for the sake of patient safety. It should be reviewed before every intervention so that the doctor may be rewriting the orders, the patient condition may be changing throughout. So it's definitely, it has to be reviewed frequently.
Yes, a very valid point. How often nurses review the doctor notes or doctor progress notes is very important, as you rightly said. Yes, as we're trying to quote here, if at all doctor writes a bradyarrhythmias present and there's a plan for TPI, but then this fresher nurses or nurses who is not able to understand what is a TPI, which is again temporary pacemaker implantations. Yeah, so do the instructions for the drug orders. So going forward again, like, do nurses feel good when the handover is effective? Lydia, I think
Yes,
you
ma'am.
have, yes. Do you feel good?
Yes, ma'am. Of course, nurses on feel good when the handover is very effective because it reduces our stress and it also help to increase our confidence and it enhance also patient safety and it helps to more focused on patient care, ma'am.
And if at all the good handover is taken place, then the nurses will also not be called even from this hostel, right? So
Yes.
that they can peacefully sleep as well
Yes,
after
ma'am.
their
Of
duty
course.
hours. Yes. Yeah. So to understand more about this, a little bit of validation factor from Simil, what is your nurses' experience when you mentor your students? So what is their experience? What they share? Are they happy taking the over, or do they really generally would like to understand when they during their clinical hours? Yes, over to you, Sunil.
It's yeah. It's very natural that if everything goes well, people will enjoy and become happy. When patients are safe,
Yes.
when patients are satisfied, naturally the healthcare outcome will be good. So the nurses, when everything is going on very well, patient they can manage that time and plan the healthcare in advance. So definitely the satisfaction will be there.
Yes, very well said. And yes, should nurses start observing handover while they are posted in clinicals, ma'am? Dr. Siddhamma, ma'am. Yes, over to you, ma'am. Few points.
Yes, Shanti, obviously, because nurses should start observing handover steps while they are posted in the clinicals, because no
Yes.
errors should be done by any trained nurse or the experienced nurse, whoever will be there, because ultimately the patient safety is a priority. So
Yes.
always we should see that, we should have a continuous observation and evaluation, and giving an opportunity for the nurse, trained fresh nurses, trained nurses to be become confident in this handing over, taking over, because the continuity of the standardized care to be for the next sister to be handed over. So that is ultimate priority. But there are some precautions we need to take to improve every nurse who are posted for working there. Perfect handing over. Hands-on learning is very important, and real world applications, like especially the asking girls to practice in the real world situations, and apart from that, standardized handover tools to be
important,
insisted for the children to practice, whether hospital practice or not, but we should train, see that an opportunity be given for every student to become confident. And active listening is another important aspect for every student. So various aspects we should see that we should improve the students.
So going forward again, we would like to hear the challenges. As rightly we have Veer and Lydia in the session. What are the challenges that stops you all from effective handover? Yes, over to you, Lydia. At first, we would like to listen. Tell me the real challenges.
Yes, ma'am. Actually, the time constraints is first one, and most common is communication barrier. Language barriers is most common, ma'am. Then next is nurse-patient ratio, and the other one is if while during giving the handover, new admissions will come, and any emergency, medical emergencies will come. These all are the common challenges during handover.
Okay, I mean, you just said the communication barrier. What kind of communication barrier? Like, still we talk in English, or if I say Malayalam nurse, Malayali to Malayali, they will just talk Malayalam in the handover, or Telugu to Telugu,
Yes,
apart from whatever the regional. So, what kind of communication barrier? Like, you mean to say senior nurse to handing over to junior nurse, or junior to junior, or interns to junior, like that strategy or strategies you're trying to tell?
Yes, ma'am. As an intern, I faced during that time I faced some language barrier because my communication skill was not that much good. So that time I faced the little bit language barrier.
Yes, I appreciate your transparent comment on the same. Yes, I think yes, everybody during our initial times we all have faced. Yeah, over to you, Veer. What are the challenges you like to see? Because you're the senior nurse, and I'm sure you mentor a lot of your junior nurses at your facility. Yes, over to you, Veer.
Yes, ma'am. Some challenges will be there, like language difference and verbal and handovers, document issues also will be there. Some interruption queries from the other staff calls.
Yes.
So mental and physical exertion will be there.
Yes. And sometimes when we do not communicate with the patient, like patient might be hungry, or patient might be feeling like to go to toilet, or some emergency interventions like sudden decrease during output. All this we'll have to stop the handover and escalate to the doctor. Yes, few real challenges we have heard. Thanks for that. And now we have come to the end of the discussion. We would like to hear firstly from Simil, and then later by Dr. Siddhamma. What practices should be inculcated to improve bedside handover compliances? Yes. Over to you for the 2 or 3 points to Simil.
Yes, Shanti, this is a very important aspect. In addition to the existing, the quality, whatever in handing over, taking over practice, but still several practices need to be inculcated into the bedside handing over compliance, because there is a very important aspect. So this normally, other than the routine, the bookish practices, we should also implement the new strategies like training and educating. Apart from that, the feedback and the coaching, separately for every concentrating and every student at bedside handing over practices to be encouraged. The quality improvement initiatives are always encouraged and appreciated. And leadership report, like the senior nurses should take an active part in guiding and encouraging the mentors, the preceptors, or the supervisors, the nursing supervisors, or the nursing tutors, whoever is accompanying the students, must see that the guide them, support them, motivate them, encourage them into practice in a right path. And a feedback and debriefing sessions also is very much necessary for every student to become confident. And peer review evaluation, because child to child learning is very effective. So like the handing over can be practiced with their evaluations. Yes, yes.
Yes.
Then
So also we would like to hear from Dr. Simil, and then I think we are keeping the session time bound, and then we will be done. Yes, over to you, Simil.
Adding to Dr. Siddhamma, like certain protocols are important, as well as nursing auditing. Regular audit can help to get feedback. Senior nursing or nursing supervisors can observe and can give feedback, and based on that feedback, certain guidelines can be established, and maybe further training can be given. And during induction period, there should be an induction for, that is, there should be an orientation for how to give the proper handing over at bedside also. Yeah.
Yes.
fully
As
agree.
rightly everybody, as rightly concluded that effective assessment and validation from the seniors to the fresher nurses or the nurses who are working at bedside is very, very important, and the needs of this current era. Yeah, I thank you everybody for this valuable session, and I thank Dr. Siddhamma, Dr. Simil, and Lydia. Yes, of course, you did very well. Veer, you did very well too, and keep learning and keep sharing your knowledge with others. Thank you. We end the session. Thank you.
Thank you.
Even.